Hello, everybody. My name is Amber Daniels, and I currently have delirium for my conditions presentation. I currently have part B of the presentation, and I'm going to go in and explain my article. So my study is on the article that I used was the author was Van Ruden et al. And it's a fairly recent article from 2017. And in the article it states that it's important to complete screenings for delirium because of the effects that it can have on a person. Delirium can cause an increased risk of death, dementia, and cognitive dysfunctions in people who have this disorder. The prevalence of delirium in intermediate care units and intensive care units was surveyed to see the difference in the rates of delirium and also to find the characteristics of delirium to help with identifying risk factors. So they found it important to see if there was a difference between people who are in intermediate care units as well as people who are in intensive care units, and to see if there's a difference in the prevalence of delirium. And what's important with that is delirium is not always identified. It's not always easily identified. Many nurses and doctors don't always survey people for delirium. And, delirium can cause a lot of medical issues. It can cause sudden death. It can cause morbidity. It can cause high insurance rates because you can come in and out of the hospital, treating this disorder without knowing exactly what you're treating, because many other risk factors can affect you, pre-existing medical conditions, environmental factors. There's so many things that can affect this disorder, as well as, certain medications that you may be receiving while you're in the hospital, like antipsychotic meds, meds that help with stabilizing patients. All of these things factor into the need for treatment and need for identifying delirium. So delirium is mostly common in trauma patients, as well as being common in patients who have had a higher use of antipsychotic medication and sedatives. So this current study purported to find a link between delirium and trauma. It surveyed about 215 people that were in an intensive care ICM and ICU at an urban trauma hospital. 161 of the people were male and 54 were females. So in order to be included in this study, you had to be over age of 18, you had to be English speaking, you couldn't have any current traumatic brain injuries, and you had to have a score of 8 on the Glasgow Coma Scale. So in reading the article, they say that they chose these specific people because it would make it easier to identify, and it would have become too much to have people with different disorders and different types of histories, because then it would have made the study a little bigger. They wanted to keep the study a little small, so they did do, make sure nobody had brain injuries, and also this score of 8, on the Glasgow Coma Scale. So the findings of this study, which was very interesting, was that delirium was found in both patients who have used the medications, like the antipsychotic medications and the medications to help stabilize them, as a form of treatment, as well as patients who did not use the medication as a form of treatment. Now, the results of this study were a little lower than results of many other studies, but the authors did state that the people in this particular trauma unit, the 2 particular trauma units, were younger than the people of the other studies that may have been completed. And also, the findings suggest that delirium screening is important in all trauma patients in order to prevent future complications of delirium. So it's important in all trauma patients because most people do the the people who are in the ICU, because they're a little bit more severe than in the ICM. And so it's found that you should screen everybody for delirium because it'll help them in the long run. It'll help with repeated hospital visits, and also the risk factors, which can be environmental issues, behavioral issues, issues with their histories of their like disorders or health issues that they may have. So next we're going to go into discussing the web resources that I chose. I chose 5 web resources. I found a lot of good resources for delirium, but I thought that these 5 were very important and helpful to delirium. So the first one is the National Institute of Health, and it's medlineplus.gov. And this is a kind of a basic web page. It discusses delirium. What is it? Why is it important to study delirium? And I want to note that, most people who receive delirium are older adults. But, younger people that may have suffered trauma and have, different risk factors also are at risk for developing delirium. So the second one that I chose is health.gov. And on this website, they have resources, many different resources to help care for those people who may have delirium. There is actually a national dementia hotline because delirium and dementia kind of sort of have similar types of symptoms, but there is a distinction and a difference between the two. There is a national dementia hotline. So the third resource that I chose is the National Library of Medicine, and this one had a little bit more statistics about delirium, articles about how to treat it, how to handle a family member that may have it, and ways that you can help them. And it also does have some resources, some hotlines on there that's very important for delirium. Some signs, some symptoms, some new things that you can learn. And the fourth article is American Nurses Association. So I thought that this was important because it's important for screening to be done. A lot of screenings can be done while they're in the hospital or while they're in a physician's office, to screen them to see if there are signs or symptoms or even risk factors, to see what risk factors they have with them developing dementia and ways that you can help them, to overcome this disorder. So I really thought that this was important because, nurses are important and they have a way to work with clients, to work with patients, and this will be helpful in, delirium and combating the effects of delirium. And the last one I chose, which I thought is a very important one, is called the American Delirium Society. And on this webpage is everything about delirium. They complete studies, they use research, they have background, they have therapy and treatment. They have everything you want to know about about delirium is on this webpage. It's all about delirium society. The Delirium Society. And what I found to be very interesting is the previous webpage, the Nursing World. They have like a joint venture together with the American Delirium Society to, provide research, to provide education, support, different tools to help with delirium, because delirium is something that can be, very detrimental to people who suffer with this disorder. So, I feel like all 5 of these resources, are very good because you can learn about the disorder, ways to handle it. So, these are my 5 disorders. So I really enjoyed this project. I didn't really have much, what should I say? I didn't really know much about delirium. So just by doing this project alone, I learned about delirium signs, symptoms, and, ways to help with the clients that I work with, and, help them to be able to, overcome this, and, work with treatment. From a little bit of research I did, it don't seem that they do use a lot of medication for this treatment. It seems that there's a little more therapy, trying to work on the risk factors first, which can be the medication. So it may be treat the medical issues that they may have. So it seems like this is gaining a lot of attention now, and a lot of different doctors are starting to pay attention to this, and then find different resources to help people that may have delirium. Thank you for viewing, and enjoy.